Good morning. Welcome, everyone. We're going to be waiting a couple of minutes to let everyone join before we get started. Good morning, everyone. We're just waiting for people to hop on. We'll get started at about 12:03. Good morning, everyone, and thank you for joining us. We're going to go ahead and get started. Before we begin, just a few announcements. One, everyone has been muted, but the panelists for this webinar, we will be doing a question and answer session at the end of the webinar. Please use the Q&A box that you'll find down below to ask questions throughout the webinar, and we'll try our best to get to them at the end. We're also going to send out the slides and a recording of this presentation following the webinar, and are also working to stream on Facebook or YouTube Live right now if you want to connect and ask questions through either of those mediums through the National Employment Law Project's pages. So good morning and welcome. My name is Julia Simon-Mishel. I am the supervising attorney of the Unemployment Compensation Unit at Philadelphia Legal Assistance, one of the main legal aid providers in Philadelphia. I'm proud to be doing this webinar with you all this morning, and a culmination of 2 years of really hard work by the authors of this report on a topic that has become essential in today's world with the pandemic. So the presenters we're going to have today are of myself, Andrew Stettner, who is a senior fellow at the Century Foundation, Michele Evermore, who is a senior researcher and policy analyst at the National Employment Law Project, and Cleo Chang, a freelance journalist. So I'm going to be going through the presentation. We're going to have an overview of kind of how we got here. Right, this presentation is looking at UI benefit modernization, right, which is really talking about the technological upgrades that have been done and states are currently doing to their systems. As all of you know from a lot of the different reporting that's been done on this topic, many states are still operating off of old mainframe computer systems that have both security and efficiency concerns, and states are moving away from those. And as you'll hear today, we're really focused on how those improvements to technology can really enhance the experience for workers and remove a lot of the barriers that you've heard about during the COVID-19 pandemic. So after Michele gives an overview of the UI system, you're going to hear from Cleo about her experience applying for unemployment, and then we're going to do an overview of the project itself. Andy's going to go through the quantitative data section of the report, where I think there's some really interesting conclusions that haven't been discussed before, and then we're going to go through some recommendations before taking questions. So before we begin, I just want to really thank several groups for their support of this project. First, the other authors of the report, Maurice and Selim, who is now with the California Strike Force team, Martha Coven, who has been a consultant on this project since the beginning and has been a fantastic resource to us throughout the project, and Ellen LeClaire, who has been one of the main researchers and traveled with me for pretty much all of the focus groups and all of the state trips, and we couldn't have done this without her as well. But most importantly, I really want to thank the Robert Wood Johnson Foundation. The foundation recognized all the way back in early 2018 that this was an important topic and that UI access really not only implicates people's economic stability, but the health and welfare of workers across the country, and that we really needed to look at the technology behind these systems. And so thank you so much to Robert Wood Johnson Foundation for recognizing that so early on, and for funding this project. And then finally, we spoke to a lot of people for this project, a lot of state agencies during our initial national overview. And then a special thanks to the state agencies in Maine, Minnesota, and Washington for giving us the time to really sit down and talk with you and talk with your staff, and also provide a lot of documentation that we requested. This wouldn't have been possible without you, and we really appreciate the openness with which you approached this project, as well as all of the claimant advocates and workers who we spoke with throughout this process. So thank you again to all of our partners and all of the participants. This would not have been possible without you. And so with that being said, I'm going to hand it over to Michele Evermore to talk about the UI system and how we got here.
Great, thank you so much, Julia. So I'm going to give you a really brief overview about what unemployment insurance is and does. I don't imagine there's a lot of people who've logged into a webinar about UI IT who don't know about UI, but just in case. So unemployment insurance is a federal state system, and states have very broad discretion in order to set eligibility requirements, weekly benefits, disqualifications. The states really do administer every piece of this program independently. And so you've got 53 different systems out there, including all 50 states, Washington, DC, Virgin Islands, and Puerto Rico. So the Federal Department of Labor approves state laws to make sure that they conform with federal law, but they are given broad discretion on how they set the law, how they set eligibility, and how they administer that. It provides the following benefits. So number one, obviously, when a person loses a job, it replaces part of their income. But as we're seeing now, one of the key elements of unemployment insurance is that it helps the entire economy by boosting spending and maintaining, some level of spending ability during a recession. So a robust unemployment insurance system actually is good for the entire community. It was estimated during the last recession that every dollar spent in unemployment insurance generated $1.61 of local economic activity. The other thing that it is intended to do, and this has been a little bit controversial, during this recession, is that it actually is it is intended to make sure that people have enough money coming in that they're not pressured to take a terrible job to replace whatever job that they lost. And so that maintains some stabilization of wages as well. The other thing it does is it provides attachment to the workforce. People must certify that they're able, available, and actively seeking work, and perform some number of work searches or work search activities. And the other thing is, when a person signs up for unemployment insurance, they're also enrolled in employment services And then they have access to job search and training assistance through collaborative agencies. Next slide. So this is what I really wanted to spend time focusing on. How did we get here? This recession has shown what we knew going into this report, that state UI systems were not ready for a recession. So both nationally and within individual systems, there have been issues. So just by way of comparison, I have here that in fiscal year 2020, the appropriation for administration of UI was 2.14 billion. And in 2001, that was 2.21 billion. And that's in absolute dollars. That would be 3.2 billion using a rudimentary inflation calculator in today's dollars, but also population has grown. So they're serving far more people. And I made a typo on this slide. Sorry about that. I just noticed. But the historic high was actually 695,000 in October of 1982. So don't take notes from this slide. I accidentally wrote 295,000. It's actually 695,000 in October of 1982 is the highest new claims number in history. And so we faced really an unprecedented increase in new claims during this year. You know, we've never had a pandemic like this since unemployment insurance has been in place. So this was a new experience for everyone. New claims exceeded 6.6 million for two weeks in a row. The first week after shutdowns, states processed 3 million new claims. And we're still processing you know, between 1 and 2 million new claims every week. And this is after 6 months straight. So state agencies are really under a lot of pressure. Not only have they had to pay out historic new claims, but they've had to set up pandemic unemployment assistance. They've had to set up pandemic, which is a parallel program to regular unemployment insurance that allows people who don't qualify for regular unemployment insurance but lost work because of the pandemic to claim a benefit. States had to set up pandemic emergency unemployment compensation, which is an additional 13 weeks of benefits for people getting regular unemployment insurance. And it had to set up a way to pay out the additional $600 of federal pandemic unemployment compensation. And then later, this whole new, even more complicated lost wages assistance program administered jointly through FEMA and the Department of Labor. So this has been a tough year. On top of that, we know that, you know, only 16 states had fully modernized their IT systems. There's really no dedicated stream for IT. So they have to figure out that, how to, you know, deal with their tech with this small amount of funding that they have to begin with. Now, during the last recession, through the UI Modernization Act, funds were appropriated for states to improve their systems, but it wasn't dedicated entirely to IT. It was for other systems improvements as well, and so that was 4.5 billion. But I would add that of the states that modernized their IT system, you know, some did so with an eye to exclusion. They modernized their system in a way to deliberately limit access to benefits. And so, you know, states like Florida and Michigan put in place systems that, you know, weren't modernized with the idea of making it easier for claimants to get benefits, but rather the opposite. The other thing to keep in mind is that for the last 10 years, there's been a real focus on overpayments, including fraud, and that has led to a lot of slowdowns. So basically, stop points have been interjected into a lot of these systems to hold a benefit anytime there's any question, anytime there's anything at all remotely unusual with the application. And as we all know, no two claimants look alike, no two jobs look alike. The workforce is shifting, the nature of work is shifting. And so combining that shifting nature of work with an over-focus on fraud has meant that, you know, as of last year, you know, only about 28% of unemployed people were even able to access a benefit. And a lot of that has to do with the difficulties with tech. With that, talking about difficulties, I'll turn it back over. Actually, one more slide. Sorry about that. So one thing about this being a state federal system is that there are states that, are in a race to the bottom. And so if you look at these two top maps, there are two key measures of the sufficiency of unemployment insurance. One is recipiency, and that's the number of people who are able to access a benefit, which was as low as under 10% in North Carolina last year. And the next map shows replacement of lost income. And as I map this, I realized this looks like something else that I've seen. And so I mapped the Latinx population and the Black population, and look at that. It's almost like a photo negative. The worse the benefits are, the better the benefits are, the whiter the population, the worse the benefits are, the higher the likelihood that the state has a high Latinx or Black population. And, again, sorry to always call out Florida, but if you look at recipiency and replacement of lost income, and then Latinx and Black population, like that is a state that modernized, but didn't do so with an eye on benefit access. And so now with that, I turn it back over to Julia.
Thank you so much, Michele. And as you all can see from that, and as you've heard stories throughout this pandemic, for a vast majority of workers, their only access to the system during the pandemic has been through the internet, as it has been nearly impossible to reach any state agency by telephone. And as you'll see in the report, and we highlight, the access of Black and brown workers to in-home computers falls way behind that of white workers and has really only compounded the oppression of those workforces during this pandemic. But what you're about to hear, and as someone who represents some of the most vulnerable workers during this pandemic, you hopefully will be surprised, or maybe not, to hear the story from Cleo, who's about to share her experience with the UI system. But I'll tell you that the amount of phone calls I've received from friends, family, colleagues who have masters, PhDs, who you would think would be able to navigate this system on their own, who had trouble, really just highlights the system doesn't work for anyone, but it really doesn't work for the populations that Michele just mentioned. So with that, I'm going to pass it over to Cleo, who wrote a phenomenal article about her experience. Cleo, take it away.
Yeah, thank you so much for having me. So basically, I was in a pretty, I think, fortunate position compared to many other people. When the pandemic started, I was working as a full-time reporter at Vice, and I actually started reporting on unemployment as people got laid off. And I spoke to tons of people around the country who were having huge issues applying for unemployment, accessing benefits, getting in touch with anyone. And I was speaking to policy experts, like a lot of the people here I interviewed. I had access to lawyers and basically was reading up on the new PUA laws. And I remember saying to my editor basically that it's good that we're doing all of this reporting right now, because when we inevitably get laid off, we'll know what to do. And it's sort of a joke. And then the next week, of course, we got laid off. So I felt very, I knew that I thought that my case would be pretty simple and straightforward. I got laid off from a W-2 job. I had a good grasp of the system from my reporting. And it actually took, instead, 98 days from beginning to end for me to actually get my benefits. And a lot of that was, super confusing. Even though I understood the system really well, a lot of it was arbitrary. And a big thing was trying to get in contact with the DOL, which I know a lot of people struggled with. And, I tried everything. Like I DM'd them on Twitter, I called their lines, and I finally found out through a Facebook help group that the best way, at least in New York, to contact the DOL was to call Governor Cuomo's office, have them route me through to the DOL. So I did that, and I waited for a couple hours on hold. The first person who I got through to the DOL, their computer wasn't working, was on hold again for another hour, finally talked to someone. And basically they told me that I had been rejected from regular unemployment, which I hadn't realized. And they asked me application questions for PUA, which is for self-employed workers. The questions were very confusing. I remember specifically they asked me if my workplace had closed as a result of COVID, and I wanted to clarify. I said, you know, Vice offices are still open, but I got laid off, so I'm not sure what I should say. And they were like, well, where do you work right now? And I said, well, I'm a freelance journalist, so if I do any work, it's from home, like in my office where you see me right now. And he just repeated the question, and I said, no, my home office has not closed as a result of COVID, and I was very swiftly rejected from PUA. And at this point, I think if I hadn't, you know, done so much research on this topic, if I didn't have access to friends and policy experts who could help me, and like unemployment lawyers, I would have certainly given up. I would have been like, I'm not eligible, but I knew I was. So I like reapplied, I filed an appeal. Eventually I got a call from the DOL, and they restated the PUA question. They said that I had overinterpreted it the first time. So I answered it the other way. They put me on PUA, and sort of just like the point of my experience, I felt was that I'm the perfect candidate to apply for unemployment, right? Like I have access to a lot of resources that people don't have. I had the time and energy to spend like pursuing my case. I don't have children that I have to take care of. You know, I had enough savings to, you know, tide myself over until I received it, but that should not be the qualifications you need to access these benefits. In fact, it should be much simpler. And most of the people who I'd spoke to in the course of my reporting, you know, even just a small obstacle could become a huge one. Like a lot of people only had phones, right? They didn't have laptops to access the internet, and they were like, I simply can't even access these sites on mobile devices. So even just like small stuff like that, I think can make or break people's experience when applying for unemployment. So yeah, that was basically my experience. And I was unfortunately a lucky person, I would say, in this situation.
Great, thanks, Cleo. And one of the really astounding parts I found of your article, what we've seen here in Pennsylvania as well, is how much community support has been necessary for people to navigate these systems. The amount of Facebook groups that have popped up, Reddit, you know, everything like that, where people have to rely on sometimes half-baked information from other people who are trying to navigate this system because there are no access points to the agencies. Again, despite the fact that a lot of agencies have staffed up and are trying to offer more channels for support, really people are relying on each other right now. So I'm going to go through the overview of the modernization project that we've just completed. And of course, much more detail is available in the report, which is online now, and we encourage and hope that you will all tune in and read that. But first, as I said, this project began back in 2018, fall of 2018, when we first started to realize that a lot of states were moving on these modernization projects, and we had not seen anything about best practices from the perspective of workers. As someone who has been appointed to an advisory committee in Pennsylvania overseeing our modernization project, I was looking for resources and realized there just wasn't anything out there. And so we began this project, and the first step was to speak with as many different individuals and agency leadership for states where they had actually modernized their UI system. And for all of the policy wonks on the call, when we talk about modernizing the UI system, again, we are talking about moving the technology away from a mainframe legacy system onto web-based or app-based technologies. We're not talking about modernizing the law, which is how that term was used a lot during the recession. We're talking about the actual technology. And so we spoke with a lot of the different individuals in leadership about their experiences, really wanting to know, if you were going to do this again, how would you change it? What did you like about what you did? And most importantly, what would you suggest to other states that are beginning this process? And that really helped form the foundation of a lot of the recommendations that we came to at the end of the report. But then we delved in even further and did three different case studies with Minnesota, Washington, and Maine. In each of those states, we spent up to 16 hours meeting in rooms with agency leadership, with staff from many different parts of the UI offices in those states to really understand both their experience during the modernization project and, again, what their feedback would be for other states that are looking to modernize. And I'll just note that all of these in-person interviews were conducted prior to COVID-19. And then in each state, we also met with advocates from different legal aid organizations or unions to hear about the experience of the people they represent, to understand if they had any part in the modernization project, what their feedback was on what the state had done. And importantly, we met with workers. We made sure to do 2 focus groups in each state, one in a more rural area and one in a more urban area, where there were between 8 and 12 workers in each focus group to, again, really understand their perspective, what they thought about the UI system. For a lot of people, we were able to talk to them both about their pre-modernization experience versus their post-modernization experience, and really got a lot of great feedback that I hope will help states moving forward. And then we also did, and this was primarily Andy, a quantitative analysis of a lot of the data that's out there, really looking at the effects of modernization. And we also paid particular attention to the use of different types of artificial intelligence and automated decision in these systems, trying to understand how it was being used and whether it was potentially harmful to the workers that we were focused on. So talking first about the national review, we heard from a lot of different states. As Michele said, funding is scarce. It was really hard to do these projects without a particular source of funding. And really, when there was funding, that funding was based on the need to do fraud detection, which really did not provide the kind of broad funding needed for these projects. There was a big push to really think about your internal business processes in each of these projects, and also to include staff from all your different UI functions. The big thing is that states often lack internal IT expertise, and it's really forcing states to focus primarily on outside vendors, which, as we'll talk about later, has had some consequences. A big note was don't hold to a tight deadline. The amount of seats that have gone live because they promised they were going to go live on a certain date, the legislature required it, their funding was about to run out, or the vendor set the deadline, caused major problems, especially when they weren't ready to go live. They also want to make sure everyone knows don't go live during low claim months. Now, currently, that is just not available. There is no low claim month right now, but in the typical world, that means not going live during the January through March period when we're in the first quarter of the year and the highest claims are coming in. And finally, improve worker self-service options. People will always need to get through on the phone, but if you can give them access to information and make that information understandable and have them take action on their claims online on their own, that will really cut down the work for the agency and improve the experience for the worker. So we then delved in even further with the individual states involved in the case study, all of whom I think really tried hard to improve the worker experience in their projects. And we really appreciate how open they were in our communications and how reflective they were on the projects themselves. And while I think generally all of these states did a very good job, we really learned throughout the process that they were really missing the worker experience at the center of their design, that their design is often focused, understandably, on how to improve agency function. But we did get some really good feedback again, and I want to focus in on a couple of those. In Minnesota, a real highlight was that they focused on eliminating the complexities in their business practices, right? They didn't want to take a brand new system and just place it onto business practices that they thought were not effective. They wanted to redo business processes and create a system that matched that. And at the center of all of that was a triage system for their call centers that really the main part of a functioning UI system is the call center. One thing about Minnesota, and I'll go over this for all the projects, is Minnesota worked with a vendor that was later bought out by Deloitte to do their modernization project, but they own the project code. That is very unique among all of these states, that they actually own the code and can make changes at their own will to the project. And then finally, Minnesota really took the approach of meeting workers where they are. The idea that when they have a worker's attention, they want to get questions out the door, they want them to answer then and there, so that they're not chasing people down and they can move claims quickly through the system. In Washington, they also used a private vendor. They used Fast Enterprises, which sells what they call a COTS product. And as someone who works in a state where we also bought a COTS product, I'm putting that in quotation marks because if there's one thing we learned clearly from this experience is there really is no off-the-shelf product for UI. The system is complicated. The system has different policy implications in different states. And the idea that you can have a one-size-fits-all modernization project for all of these states when the way their laws are currently written just doesn't work. Now, this product did allow Washington and a lot of other states who also bought similar products to move more quickly through their modernization project. And as you've probably read, Fast Enterprises was involved in a highly problematic implementation in Michigan involving serious issues with fraud detection and incorrect fraud assessment. But Washington worked really hard to learn from that experience, engaged individuals from the Michigan system to really improve upon the product and ensure that their workers were not going to face that same disaster. They also really involved frontline workers in the project, made sure to pull top-line people from all the different parts of the agency, and really focused a lot on the need for continuous internal training. They recognized that with pushing back the go live date in their system, they hadn't been able to have that continuous training as much as they would have liked, but really wanted others to know how important that was. And really, Washington of all the states had the best self-service options for claimants to be able to go on and navigate the system themselves. And then finally, we worked with Maine. Maine was one of the states that participated in a consortium. And that meant that they shared the product with other states. They really focused on making internal business decisions that balanced out implementation problems that existed. They had structured sandbox time for staff, and they've recently really engaged WorkSource staff to set up mobile labs for workers. So while they had a highly problematic implementation, they've really worked to improve the worker experience since then. So quickly on but the main takeaway, of course, and the main takeaway from this report is that none of the states really centered workers in the design and testing of these modernizing systems. And that was really obvious based on what we heard from the worker feedback as well. So from talking to the workers and all of these focus groups, really the takeaway from folks was the system doesn't want me to get benefits. It's not welcoming. It's not easy to understand. I can't get through. It feels like they don't want me to have this. And I think that really was, affecting recipiency for a long time from an anecdotal perspective, that people were just giving up on these systems. And this was before the pandemic. So we really came to understand that these systems were difficult for them to navigate, especially work search questions. They had lots of problems with the online applications and timeouts. They could not find information on their online portals. As you've heard a lot about, there were also considerable password reset problems where they just could not get online to navigate their claims. And most importantly, they had a ton of questions. They didn't understand the system. They didn't understand how the law impacted them, and they couldn't get through on the phone, again, even before the pandemic. And they found often that, unfortunately, workforce centers where they would go looking for assistance could not help them and were practically useless as any sort of in-person support. A lot of feedback about the inability to navigate these systems on their cell phone. While some states have mobile responsive systems, a lot don't. And even the ones that do, there were just lots of glitches that seemed to kick people out as they were trying to go through. And while we think it's really important that access to paper notices is maintained in states for populations that don't have good access to the internet, a lot of people were really confused as to why they received tons and tons of paper in the mail that they'd already seen online, that they had already talked to someone about, and how they received important notices in the mail they didn't get in the online system, and they missed a lot of things because of that, and sometimes got disqualified. And so the last point on this is that, you know, what we really came to understand is that there were workers who had support systems, especially a lot of workers who were unionized, had an easier time navigating these systems, especially because of that support system. But for the most vulnerable workers, it was really difficult. Just one example, when we met with migrant farm workers in Washington State, only 1 of 11 workers had ever used successfully the online system. They all needed to get through on the phone. And unfortunately, none of these states, and none of the ones, no state in the country has created an access point for advocates. So while employer representatives can get into the system, worker representatives do not have an access point to these systems. So I apologize, I am over time here, so I'm gonna quickly go through the AI pieces. So as we said, federal funding has prioritized fraud detection. And if you look at the vendors, that is one of the main tools that they are pushing. A lot of little vendors have popped up really just for that purpose. What we have found, and what has been found across the board, is that when risk assessment algorithms are used and states aggregate data, it often not only introduces, but can sometimes cement discriminatory bias that already exists in the agency's processes. This really results because underlying data itself comes from other systems that perpetuate systemic racism, and often bad data leads to bad results. If you're getting a cross match of bad data and you disqualify someone from that, or you flag them for fraud because of that, that's a real problem, and it's often hard for people to fix that. We found that it's really vital that any sort of fraud detection or eligibility determination should always have a human touch in the system, and all the states we talked to felt similarly. There's a lot of talk about things like nudging, which is using predictive analytics to provide more information to certain people about their claims and as they navigate the process. Unfortunately, that has only really been minimally effective according to the states that have used it, but we are curious about whether it could be used in different places to help people actually understand the system, not simply as a means to prevent improper payments. And finally, that there's a lot of issues out there, and we didn't get to talk to all of the states, and so we don't know what other types of technology is being used out there, and really black box technology when states are using algorithms that are owned by vendors and they don't have access to the means of how those algorithms are working, raises significant due process concerns, and we believe also puts agencies at legal risk. So the real takeaway when we're talking about AI is, does automation put workers in a worse position? Meaning, if it goes wrong, right, are they worse off than they were before? And really, if you're going to use automation, the way to do it is to use it in a manner that if it goes wrong, people are still at the status quo, right? You're using it to improve the experience, and there's not any harm that's going to come to workers if it is not effective or if it's inaccurate. So with that, I'm going to pass it over to Andy to talk about some of the quantitative analysis for this project.
Great. First, thanks to my co-authors, Julia, Michele, and Maurice and Ellen, who are on the line. Especially thanks to Cleo for joining us today. And I also want to extend my thanks to all the states that helped to provide this data and work with us so hard in the focus groups, and a number of advocates and unions that helped to make access to their workers and their staff possible. So I'll just kind of try to briefly go through the quantitative findings of the report. So, you know, just to underscore what Michele said, the purposes of modernization ought to be to ensure timely payment of benefits using the power of technology. And so that's something that's required by federal law and regulations for states that they have not been able to meet even before the pandemic. This first graph is the 87% first payment timeliness standard, paying benefits within 14 or 21 days, depending on the state law. And you'll see that back starting in basically 2007 and on, they have not been able to meet that standard. And we went, even further down, obviously, through the second quarter of this year in that data. And this timeliness has worsened during the pandemic. States had to weather this record crush of claims. And the other really key aspect we were researching with modernization was adjudication. That's deciding contested claims. And they also have requirements there. States are directed to decide 80% of adjudications within 21 days. And in the latest data in July of this year, only 2 of the states have met that. And we have this and a lot of more current data on timeliness on our new UI data dashboard. So one major finding looking nationally at modernization and UI is that modernization really did coincide with a period of increasing denial rates in UI. And when I mean denial rates, that's people being denied that actually take the step of filing a UI application. So as the number of states modernized increased, we saw increasing denial rates. It was also a period when the overall recipiency of UI benefits also declined. That was the first call Julia made to me about this project, was maybe modernization is one reason that recipiency is declining. So we did look at that. We tried to tease that out more. And in the end, we found that recipiency both declined in states that modernized and did modernize, and that rate was not statistically significantly different. However, there's a big difference in denial rates. The denial rates actually increased in those states that modernized from before the modernization period in 2002 to 2018, but actually decreased in non-modernized states. And what's really driving that increase in denials is the increasing denials for work search, availability for work, the things that are not when you first apply for UI necessarily, but during your ongoing claim. And our interviews with stakeholders that we conducted, both in the state level and across the UI system, was a feeling that many workers were violating the rules for work search and availability, but had gone undetected in those violations before modernization. But some of the other data collected were not able to confirm that hypothesis. If that was true, you may have seen that the overpayment rates, which are constructed in the bottom of this table through an audit, a random audit in each state, you may have thought that the overpayment rates would be higher in not modernized states because they're unable to ferret out some of those work search violations. We did not see a statistically significant difference in the overpayment rates between modernized and non-modernized states. Next slide. So let me talk about some of the state implementation findings, and starting with Maine. One finding was, and Julia references, that state leadership and implementation was key. Maine was one of the states that did have major problems with the rollout of technology. We know technology rollouts across all sectors of our economy have trouble. This led to major delays in payments and problems either when it came to passwords or also filling out online work search forms, another key task. In our interviews, we did find that the state leadership really recognized this, and they intercepted it, and they held rather than denied the claims. So you didn't see that increase in denial rates in the state of Maine, and they really kind of bucked that trend, and they're able to do that at the same time that they actually did use the technology to reduce overpayments. Next slide. Washington, too, also did face challenges with the role of their technology, in particular related to coming out in the busiest season, and it left phone lines jammed. And it led to a period where less than 1 in 5 phone calls was connected. What we found in Washington and all of our states, and many of the calls into UI are customer service related. Things like resetting your password or trying to understand where your claim is. In Washington, the states redeployed their resources to have more call-in agents that will be able to answer those calls. And 1 year after that launch, they're nearing 100% connection rate of their claims. So really, you do have to think about the staffing for these modernization projects. Next slide. So I wanted to just talk a little bit about how modernization has changed the nature of UI claims finding from our research. Nearly all states today have websites. I want to understand that. Most claims for UI are filed online on the web. However, not all systems have modernized systems that are web-based technology that can truly collect all the information that is needed to start a claim. This is a major issue that we saw in New York, where Cleo shared her story. To complete a claim in New York that you start online, you do have to connect with an agent, and that was a major delay. And so you see this change through the fourth quarter of 2016. There was a lot of online claims in Washington, but most of them required, or half of them required an agent to complete them. With modernization, you saw the change, that almost everyone who's able to file online is able to complete their claim. However, the percentage of phone claims, you'll see in that graph on the bottom, is basically steady. Workers continue to need an option to be able to file by phone. So that is, if they don't understand the online claim through language, disability, or other, I mentioned those that are federally protected, or just other reasons that they want to and need to file online. And we really think through this project and this pandemic that we need to maintain a phone-based online system. And I think that's my last slide. Back to Julia.
Great. So we're going to run through our recommendations for the project, but again, I really refer you back to the report where we go through these in detail, and then we're looking forward to taking some questions from you folks. So I believe we're going to start with Michele on recommendations that can be done right now.
Yeah, so here are some super easy top line recommendations that seem pretty logical. So first of all, just keep the computer access open 24/7. It seems like it seems illogical to shut down the website at 5 o'clock. The website doesn't have a family to go home to, right? The other thing is to optimize websites and applications so that workers can both upload documents from mobile devices and even really have good access through mobile devices. A lot of people, as was mentioned earlier, do not have access to a desktop computer. Update password reset protocols. In many states, we found that in order to update your password, you have to actually call in, and we know that 1 in 100, 1 in 1,000 calls we're getting through during the depths of the recession. You have to call a person, tell them you need your password reset, and they will send you a new one in the mail. And as we all know, the mail isn't operating optimally right now. The other thing is to use callback and chat technology. States have been implementing this, and it's been really helpful. So you call in, and they tell you, they give you a time that they're going to call you back, or you give them your number, and they will call you back, instead of dealing with some of the nightmares that we've heard, that people are sitting on the phone for 12, 24 hours waiting to talk to a person. And chat technology can also answer some basic questions. And this is super key and actually required by law. So states should already be doing it, but they are not. But states need to translate online materials into commonly spoken languages.
Thanks, Michele. So really the main takeaway from this project is the need to center workers in both the design and implementation of these projects. But in general, the recommendations we took away from this project are really about asking those workers what they need and evaluate your business practices so that they're not slowing down benefit evaluation and payment. Really, states need to control the go live date. They need to be the ones making the decision in consultation with stakeholders about when the project is actually ready to be implemented. Stakeholders, including employers, workers, social service agencies, really need to be involved in the design process. Those are the individuals who can understand the challenges that workers are going to face trying to navigate these systems. And on that point, it's vital to build in time and funding for extensive UX testing, which is user testing. All states do what's called user acceptance testing, UAT, but that's when you have engineers and internal staff testing the project to make sure it does what it's supposed to do. That's very different from getting feedback about how people are actually navigating the system and what barriers they're experiencing. It's really important to provide multiple channels of communication with the agency through the modernization project. Michele mentioned that on the past slide. And as Andy said, staff up call centers. The states that we did case studies in really found that their call numbers really skyrocketed after modernization, and they actually had to add staff at that point. It's really important to coordinate with workforce centers and to figure out really where that line is between what workforce centers can and cannot do on UI. regardless of what the law says, people see those centers, and to them, that is UI on the ground. That is their in-person UI support. Finally, a robust engagement plan is going to be really important to help educate the public and stakeholders about what this project means, how to navigate the system. If you just turn a switch and all of a sudden you're in a new system on a new day, that's going to confuse a lot of people and create unnecessary harm. And even after implementation happens, it's really important to get ongoing feedback from workers. And we saw that in all of the states that we did case studies for. They really focused on getting feedback after go live and making changes based on the feedback that they got. Andy's going to speak briefly about some federal considerations, and then we'll take questions.
Yeah, just briefly, we mentioned in this overview the need for more funding for IT modernization and administration in general, and an increased focus on accessibility and timely payment, and that includes enforcing some of the legal requirements that states have around LEP and access for people with disabilities. And finally, we need better data. We have some data about timely payments and timely decisions. We don't have data on people who have not been decided, and we need better data on that. And we need that kind of data I shared at the end around call centers and online claims filing at a much more granular level. States collect it, but it's not collected by all states.
And with that, we're going to start answering some questions. The first of which, and Andy, you just touched on this a little bit with the federal considerations, is what were states doing to improve access for workers with disabilities, and to really look at questions of plain language and getting rid of jargon? Did we see any of that? What should states do? I can start. So one of the states we talked to did a usability study, and while that was great, unfortunately they did it towards the end of the project and were not really able to implement any of the recommendations. And in general, we did not see that usability studies were done when it came especially to language. I think what the pandemic has highlighted is that most people don't understand the UI jargon, and while these projects have really been focused on changing the technology, a lot of times they're just taking the old language from the old systems and putting it in a prettier setting. And that's not good enough for most workers and creates more barriers. And there really hasn't been a focus on access for workers with disability. There's a lot of ableist issues with UI systems that we really need to take a deeper look at. There's another question about the fact that these projects are called modernization projects. Are these really modernized systems? Why are we calling it that? And what changes are really needed in, let's say, procurement models to move away from these outdated models that we're highlighting here?
Yeah, I can try to answer that, briefly. We did, in the course of our study, see states begin to kind of move to more agile software development, thinking about containers or other ways to distribute different pieces of technology. And I do think that's one benefit of the pandemic. I will, say I was in a meeting in 2005 where the waterfall approach in New York was described, and we didn't make it by 2020. So I think going to the more agile approach of deploying software, testing it, and having that be part of modernization. We've seen that in Maryland, where they've rolled out pieces of the new system. I know other states have rolled out PUA on platforms that will become part of the part of the effort. So starting to replace the mainframe one by one. Eventually, the mainframe does need to be replaced, or else you are kind of stuck. Generally routing your payments through an ancient system that can crash.
Thank you, Andy. And I'll also note that in the report, we do talk about procurement and some of the issues that states should consider when they are building an RFP and when they're designing the contract with the vendor. So one question is from someone that is it really that UI funding is the issue, or is it that money is poorly spent through procurement mechanisms? And I'll just first and foremost say, money is always an issue in these systems. It's an issue with staffing. It's an issue with resources that go towards the holistic implementation of these projects. And while I don't think we can speak to the in-depth budgetary decisions of the states, we really heard it across the board from pretty much every state that funding was a real challenge to getting these projects off the ground, completing them timely, and getting what they want out of them. Michele, do you want to comment on any of that?
Yeah, I think also, you know, the funding is an issue. One thing I just wanted to, you know, really highlight also is that, you know, these systems are built on policy. And we also, you know, we didn't really hit this super hard, but, you know, that, you know, there is an intersection between IT and policy. And bad policy leads to the computer system kicking people out. And so, I mean, I just wanted to throw that out there for people to think about, that you need to advocate for good policy in order for the IT system to do the right thing.
Thanks, Michele. So one of the questions was, given the backlogs during the pandemic, does that change our perspective of the need for thorough evaluations of new technologies before implementation? Does that change if it's not a complete overhaul but a minimal upgrade? So I'll start by saying we've seen a lot of states make minimal upgrades that have had a huge impact on the worker population during the pandemic, and we suggested some of those in this report. And actually, I think while there's a lot that we want out of benefit modernization projects, rushing one out during the pandemic to us is not a good idea. We don't think that everything that we've said in this report should be thrown out based on the incredible need right now. I can tell you, as somebody, as I said, who serves on a committee in Pennsylvania, we recommended to our state that they not go live with the project during the next month. When numbers were this high, you're always going to have implementation problems, and when you have millions of people on benefits, you're going to have thousands, hundreds of thousands of people who have struggles with the new system. And so you want to really think about how states can make minor implementation changes to their technology right now to help workers. But if they're going to do modernization projects, they really need to do the user-centered pieces that we talk about in this report, regardless of the pandemic. So there's some questions about certain vendors. Now we do touch on some issues with vendors in this report. And you know, for advocates who are going to be working with states on this, we're hoping to do some follow-up work with you all about how to get involved. And then I believe we got to all of the major questions. Michele, Andy, anything you want to add to what I just said?
No, thanks everyone for joining us.
Yeah, we're certainly available, you know, for presentations to your state or your group, you know, etc.
And these, the slides and a recording of this presentation will be emailed out to all individuals who participated and who signed up for the webinar. So that will be coming later this week or early next week. And so again, thank you all for your participation, and really thank you once again to the Robert Wood Johnson Foundation for their support of this project. We really encourage everyone to take a look at the report and the recommendations in there that we really think are going to play a major role in the next set of benefit modernization projects. So thank you very much.